talk a little bit here, set up why we're talking about mental health at work. Why is this important and why now? Shawn, if you want to hop on and join me, that's great.
I was just
Um,
sitting waiting to click the button. Just
I
just
know you were
takes
waiting for me to say, Shawn, would you like to join? um, so, we talked about this before that there was sort of a perfect storm in a lot of ways with what happened as far as mental health, the workplace, with healthcare workers in particular, but not certainly not only healthcare workers, um, that we saw a sort of already existing needs that were quite deep even before the pandemic really being exacerbated. I think that we also see that organizationally, there's some expectation that workplaces can sort of be engines for well-being for their employees. And it's finally, and it goes without saying, that sort of generational changes in attitudes about mental health have really sort of driven this discussion. So, my parents are boomers. They didn't want to talk about this stuff at all. It was a sort of like rub a little dirt on it, you're fine, you're not bleeding, it's okay, right? And so we've seen the difference that Gen Z brings to what they expect from the workplace where mental health and wellness is concerned. Shawn?
well, yeah, I think that I think we have to say that this is a healthy change. This is progress to where we actually recognize that the workplace has a profound influence on our lives, and it needs to be an additive influence, not a negative influence. And there were generations. I mean, I saw this in medicine back in the 1990s, where you had people going into a career and they were like, I don't want this career to cost me my world. And so, healthy work-life balance was a term that was thrown around. And then you have the stresses that are going on, the always connected generations and growing up with technologies. And then the pandemic hits and it just was a pressure cooker. I mean everybody's isolated, everybody is fearful, everybody is worried, all of these sort of things happening. And to come into this and to say, you know what, as an organization, we have to take care of our people. I mean, our people are our greatest resource. It's not an office, it's not a handbook, it's not a textbook. It's our people, and we are willing as an organization to take that on for the betterment of our people and our organization. And a lot of businesses have come into this. The One Mind organization has worked on this for years about a healthier workplace, and really sort of putting together the index and bringing that all together. How are you a better employer, not in a patriarchal, oh, you poor thing, but in an empowering your people to actually have a world and have a life. I actually try and meet with every single one of our new employees. And one of the things that I say to them is I say, I really don't want to talk to you about work-life balance. I want to talk to you about having a good life. Your work is not more important than your life. You are so much more than simply an employee here, and trying to build what we can to value that. And the index was put together to address this. I made a comment this morning that I wrote down. I said, for today's generation, a healthy a mental health workplace, a good one is the 401k. They ask about it when they come in the door. They want to know that it's a good place to work and a good place to be, and to make a contribution. So I think this is fantastic.